Good morning, everyone. So, before we delve into our lesson, let me read to you the objectives. At the end of the discussion, the students should be able to address the causes of health inequities by tackling social determinants such as poverty, education, housing, and access to healthcare, recognize and understand the existing disparities in health outcomes among different socioeconomic groups, and promote health equity. Efforts should aim to reduce social and economic inequalities that contribute to differential access. Some families look different from others and have different resources too. Resources are things like foods, schools, hospitals, stores, parks, and restaurants. There are different types of resources in every family. Some communities have less resources than others, or resources that aren't as nice. The types of resources in the places where we are born, live, learn, play, and worship affect both our quality of life and our health. And we call these social determinants of health. And they can be grouped into five major categories, such as economic stability, education, healthcare, neighborhood, and social and community life. Economic stability means people are able to afford things like healthy food, healthcare, and safe housing, employment or job programs. Career counseling and availability of childcare can help increase economic stability in communities. People with higher levels of education are more likely to be healthier and live longer, but some children live in places with poorly performing schools, and many families can't afford to send their children to college. That's why there's an inequality sometimes that they treat well those people who have a degree. All people should have access to quality health care. Increasing health insurance coverage helps make sure more people get the healthcare services they need, like preventive care. Yet, we somehow experience poor treatment due to our life status, or some family with losses or socioeconomic status, they didn't often get the treatment they deserved. But a family with higher SES generally have better access to healthcare. Everyone should be able to live in a safe neighborhood where it is easy for them to make healthy choices. Safe and healthy neighborhoods have access to parks and safe sidewalks for walking and recreation, access to stores where healthy food is always affordable and available, and safe and reliable transportation. People's relationships and connections with family, friends, co-workers, and community members can have a major impact on their health and well-being. Programs and policies to help people have the social and community support they need are important for supporting health and well-being. So if you have a healthy relationship to those around you, you also have a healthy mind. Conversely, social isolation and lack of support are associated with the increased risk of mental health issues and chronic diseases. So let's proceed to quality and safety.
Quality and safety. So, quality and safety, lower quality of things inside our houses increases the risk of potential hazard. It may affect our health dahil sa low quality ng ating mga kagamitan na maaaring makakos ng mga sakit sa atin. The potential health hazard fall into four categories such as biological, chemical, physical, and social. First is biological. If your house has a low quality in terms of cleanliness, it may cause us the higher risk of illnesses biologically, kagaya na lamang ng sakit na asma. Nakukuha natin ang asma sa mga dust sa ating kapaligiran at kadalasan ay nagkakaroon tayo ng mga allergies sa ating katawan because of our dirty environment. Next is chemical. In this category, most likely in a workplace that exposes on chemicals, for example, At the plantation, those workers there are exposed to hazardous chemicals such as pesticides, fertilizers, and etc. And it has a higher risk on their health because of these chemicals that will put their health in danger. Next is physical. So yung physical naman is that when we're exposed to things that will hurt us physically in our surroundings. For example, at the construction of our house or any buildings, there are instances that we might get hurt physically because of mistake during work. It could be stones, falling, nails on the ground, and other possible hazards in the workplace. That's why it's necessary to wear PPE during our work to prevent possible hazard. Lastly is social. In social, we're exposed to potential health hazard if our environment is overcrowded and if we are at the community that's full of crime or poverty itself. These factors put an individual health at risk because of things that will affect our health. For example, if we're on a community that is dikit-dikit ang mga bahay or what we call squatter and mayroong mga basura at mga lamok sa ating paligid na nilinisan, mas magiging mataas yung risk ng health hazard kapag nasa environment tayo na ganyan. Dahil maaari tayong makakuha ng mga sakit biologically, physically, as well as sa mga chemicals dahil sa mga basura. Kaya, we really need to live in a peaceful, clean, and community. Stability. Stability refers to the state of being stable or steady. It implies a sense of balance, reliability, and resilience. In various contexts, stability can have different meanings. For example, in physics, stability refers to the ability of an object or system to return to its original position or state after being disturbed. In economics, stability refers to the condition of a stable and predictable economy with low inflation and unemployment rates. In personal life, stability can refer to have a consistent and secure environment or emotional state. Overall, stability is often associated with a sense of security, predictability, and equilibrium. Next is affordability. Affordability refers to the ability to comfortably pay for something without experiencing financial strain or hardship. It is an important factor to consider when making purchasing decisions or planning for expenses. The affordability of something depends on various factors such as personal income, expenses, and financial goals. It's always a good idea to evaluate your budget and prioritize your spending based on what you can afford.
And now, let's proceed to types and benefits. So there are three broad categories for exercise, such as aerobic, anaerobic, and agility training.
Aerobic exercise. This type of exercise is focused on improving the body's ability to use oxygen. It typically involves moderate intensity activities that are sustained over a long period of time, such as jogging, cycling, or swimming. Aerobic exercise is great for improving cardiovascular health, increasing endurance, and burning calories. Next is anaerobic exercise. This type of exercise is focused on short bursts of high-intensity activities such as weightlifting or sprinting. Anaerobic exercise is great for building muscle, increasing strength, and improving overall fitness. It can also help with weight loss by boosting metabolism and burning calories. Next is agility training. This type of exercise is focused on improving agility, balance, and coordination. It typically involves activities that require quick movements and changes in direction, such as jumping, running, or agility drills. Agility training can help improve athletic performance, prevent injuries, manage weight, and provide enjoyment for people of all ages. So overall, incorporating a variety of aerobic, anaerobic, and agility exercises into your fitness routine can help you achieve a well-rounded and balanced approach to fitness.
I hope you've learned from our presentation. So for summary, social determinants of health or SDOH are conditions where people are born, live, work, and age influencing health outcomes. factors include socioeconomic status, education, environment, employment, and access to healthcare. Addressing SDOH require multi-sectoral collaboration to tackle root causes and promote health equity. That's all. Thank you for listening.